Perfect.
Okay.
We are live on YouTube and Facebook.
All right, and we just chat for a moment while people log in.
While people are logging in, I'm just going to double check because sometimes it tells you that we're live and it hasn't showed up yet. So I like to double check in both places that we're indeed on. So as people are coming on, if they can do us a favor and give us a thumbs up, give us some comments, let us know that you're starting to tune in with us.
All right.
Perfect. I do see it. So I'll just finish sharing this out and then we can get started momentarily.
All right. Yep. So there's a few. And I think, did I ask, is there a screen share version of this?
Oh, yeah, sure. So if you can, at the bottom of your pane, you should see a share screen item. Select that, and then you'll click the next tab over where you select which application you want to be screen sharing. And then once you click that and hit share, then it should show up on my end. And for now, I am pulling some of these links for folks.
Okay. I may look to show a page from the state of Colorado's vaccine phasing.
So let's go ahead.
It wasn't a PDF, but I thought as I reference it, since we'll provide the website addresses, the URLs to everybody, they can go right to it. But for the conversation, this will be a good one to put up on the screen.
So if you want to go ahead and start pulling it up right now on the screen, I won't display it, but we'll have it in the frame with us.
Okay. Let's see. Where'd I go? Let's see. Application window. Oh, you know what? Let me open it in its own tab. I guess that's what'll.
Yeah, you're great. And I know a lot of you are starting to tune in with us. We do know we're live. We're just giving Facebook a second to alert you guys that we're on here. So go ahead and let us know who's starting to tune in. Give us that thumbs up. Start commenting in the chat, and we will begin momentarily here.
There we go.
Good. And I see it. Whenever you're ready, I'll pull it off the screen. Well, perfect. I think we're going to go ahead and get kicked off and started. Good morning and happy Friday to all of you that are tuned into our broadcast on this nice wintry morning. I'm so excited to get to today's program. But before we get started, I'd just like to give you some basic housekeeping that most of you have already heard. So bear with me as I go through this. I am Juliette Abdel, President and CEO of the Westminster Chamber of Commerce. These live broadcasts are brought to you on a near daily basis. We've been holding them from March until today. You can find many of them on the video section of our Facebook page. You can also find it on the YouTube channel where we are actively streaming today, Westminster Chamber of Commerce. Now, if you are interested in connecting with us on all of our social media platforms, we are on Instagram and on Twitter at Westy Chamber, and of course on LinkedIn, Westminster Chamber of Commerce. For those of you that are new to our page, please make sure that you hit that like button, hit the follow so you can get those timely alerts when we do go live. And all of our returning viewers, good morning and thank you for coming back to us. Make sure that you hit that share button whenever we are done with our broadcast or even during it so folks in your network can get alerted about some of the resources and information that is out there. Long-winded, but you know I like to give you those basic housekeeping. Today I have a guest that is returning back with us. He is the Executive Director of the Colorado Labs, Dan Powers. I met Dan, I want to say it was like a year ago. Now it feels like 2 years ago. But he does so much for our communities across the state of Colorado. He was with us several months back to really talk to us a little bit about, you know, what does COVID look like on research platforms? How are, how are different networks working together and what makes the most sense? So now that we've talked this week a little bit from our mayor about the vaccines, we then had the Westminster Medical Clinic talk about, the safety behind the vaccines and answer some Q&As for folks, we decided to bring Dan back with us to provide us some updates as it relates to research and anything else that he wants to share with us that we should be aware of. I see already on board Wayne Anderson. Good morning, Wayne. Thank you for hopping on to this broadcast and starting to comment along the way. There is a comment function that's available to you. This is where we will take up any questions, any compliments that you want to share away, or any overall comments that you want us to be aware of. So please get familiar with the chat function and drop in a note for us along the way. And Dan, with that, I'm going to mute myself and the floor is yours to take it away. When you're ready for that handout, let me know and we'll pull it back up on the screen.
Okay, great. Well, thank you very much, Juliet. And hello, everyone. I'm Dan Powers, the Executive Director of CoLabs. CoLabs is a 15-year-old nonprofit. We're a consortium of about 35 different federally funded research laboratories and joint research institutes on university campuses in Colorado. A lot of these entities that you might know by their acronym, NIST, NOAA, NCAR, NREL, are part of the CoLabs network. And our organization was founded with the somewhat, let's say, informal mission, without reading you the entire mission, to champion the economic and intellectual impacts and benefits of taxpayer-funded research, and telling those stories up to our congressmen and elected officials and other civic leaders so that those labs stay funded and stay here in Colorado. Collectively, these labs and their research have about a $3 billion impact on the state's economy and nearly 20,000 employees, both direct and indirect employees. And that's just within the labs themselves. Their ripple effect and connections and partnerships into the private sector of technology companies of all kinds are a part of the ecosystem and in some ways the intangible vast benefit that we have here in different innovative industries that attract companies of all types to both relocate here, to grow here, and perhaps to get started here as scientists decide to leave labs with an entrepreneurial spirit and get started. So in that spectrum of all these different kinds of labs, there's research on COVID that I wanted to prompt you to recognize just some of the activity that's going on. And I've shared a bunch of links with Juliet that we can put on the screen, and you can follow further into depth if you're interested to connect in one way or another with them. You might have technology or interests or questions that you want to get directly into contact with them, or you might just be interested to read a bit more of the details. So I mentioned with CoLabs, while we champion federal labs, that ecosystem, as I mentioned, being made up of joint institutes on research campuses relative to COVID, that particularly brings us to, or causes me to want to highlight University of Colorado Boulder and Colorado State University and the CU Anschutz Medical Campus. So let me just run through a couple of these projects that are going on that may not be on your radar yet, but I think will give you hope and perhaps not relief yet, but we're more into the hope stage of here's what's happening. Obviously, with the couple vaccines that have been approved, additional vaccines and testings will ideally be approved shortly as they go through the FDA and other federal processes. And one of those includes, for example, at the BioFrontiers Institute at CU Boulder, there was a $3 million grant from the Department of Defense to the laboratory of Dr. Sarah Sawyer. And she's been working for a couple years as a virologist to understand the basic science, understanding the body's early immune system response to infection. And in doing so with her team, it's not just Dr. Sarah, but they can recognize where certain nucleic acids are produced as our body is reacting to the presence of a virus. And within hours, in certain cases, those nucleic acids can appear in your saliva. So she had started a company, Darwin Biosciences, and they now are providing an end-to-end screening solution to detect pathogens associated with COVID-19 in individuals, including people who are asymptomatic or even pre-symptomatic. And their agreement with different production company and within Darwin Biosciences, is that they've created what they call the 6-stick. And yes, it looks like, as you've probably been hearing in the news, something similar to a home pregnancy test, but This is something that hasn't been approved by the FDA yet, but its efficacy has borne out in their lab tests, and you can check online. I've provided that link there to Juliet. And if you're interested to know more, this would definitely be one that I think would be worth checking out. Their rapid collection and analysis is meant to be non-invasive and cost-effective, and the video that they have on their site showing how this works does look actually pretty relatively, non-invasive for sure. You're just kind of spitting into a cup there. Also, then at Colorado State University, I had referenced, they've received over $16 million in funding for various projects, vaccine research and testing capabilities, and about 65% of that has come from federal sources. They're working on 44 different projects right now, including, let me read just a few of them. You can get this full bullet list if you check out on their website. They're working on studying the effects of the pandemic response on state and local economies. So not only getting into the bioscience, but into more of the social impacts. They're conducting targeted surveillance of wastewater on campus. They're doing significant saliva screening. They're testing masks and the fabrics that are used in different masks in addition to N95s to see how they're effective, how long they're effective, and what manner do they need to be re-sterilized, whether they're made of cloth or some other type of equipment. They're creating a biotank to study the longer-term effects of COVID-19. They're studying pandemic-induced stress with an eye towards monitoring abusive parenting. They're analyzing food chains and the impacts of food chain logistics, as well as whether or not any type of particular foods may retain, if that's the right word, may actually hold the virus on their surface. They're creating models to show how COVID-19 might spread through firefighting camps. That actually came up, as you can imagine, over the last couple months here in Colorado and elsewhere in the country as a concern, as you had the first responders and firefighters trying to deal with that kind of natural disaster, but of course being in close proximity to each other. Another particular example is a team at CSU that's been awarded a $3.1 million grant from the National Institutes of Health to develop the Solavax, is the name of their vaccine. The details of how that works and that it's been researched right on the CSU campus is fascinating. And Solavax, I would definitely prompt you to look into, and that might be one that we see achieving approval and out into the mix of what become all of our public health treatments here in 2021. CSU also, they converted their veterinary diagnostic laboratory, which used to, of course, treat animals and do other testing for various species of animals, but they quickly got the approval back in April, May, I think that was, might have been April, to be able to do human testing. And they've been executing nearly 5,000 tests per week for students and or for humans, I should say. And they've now done over 60,000 COVID-19 tests. They were particularly focused on people who would be working in or residents of nursing homes and other types of settings that had that kind of higher risk. But the ability for testing up at CSU has just been amazing. Let me switch over to the University of Denver now. And is this all right if I keep just going through my list of...
Oh, I think this is terrific. Thank you so much, Dan. This is so informational. I'm just trying to capture as many notes as I can on my end. I see with us Summer and several other folks that are hopping on. We have Dan Powers, Executive Director of CoLabs. He has given us a nice overview of the impact of all the network of labs here across the state of Colorado and the billions to our economy. Of course, the indirect benefits to several other industry. He is now deep diving into what research is out there as it relates to COVID, research that's focused around testing, about methodologies, and even prospectively where you can potentially get the transference of COVID. I thought some of those links are actually dropped into the comment section of this broadcast. Dan, you can keep on going, and I will continue to bring up the links as you are referencing them as well.
So I'm jumping over to the University of Colorado, Denver, the Anschutz Medical Campus. They have numerous studies that are being funded by the National Institute of Allergy and Infectious Diseases. That is a branch of the National Institute of Health, and it's the organization that Dr. Anthony Fauci is the director of, which most people are likely very familiar with his work, or he in the news from one perspective or another. Also, and check out that link that I've provided to Juliet if you are more deeply aware or interested in particular types of medical research. The list that you can click right on and get very deeply into the National Institutes of Health's information about what's going on with their testing or their research would be quite valuable and interesting to you. At UC Health, they're doing all sorts of testing, and I think I included the link there for you. They're a network of hospitals that are really the teaching hospitals for University of Colorado. And with these hospitals, they've partnered with a couple different biotech companies who are in clinical trials with different vaccines. In particular, the AstraZeneca COVID-19 study has more than 1,000 people who are participating in that particular trial. And then also they are working with, let me go through my notes here. With Moderna, they have another 200 plus people who are participating in trials with the Moderna vaccine. So if that's a realm of interest, follow the links to what UC Health is involved in, and that might be where you can actually get more directly connected to field trials, field studies, and see what the results of those are and what the pacing might be for those to come forward. Let's see. So I gave you that link. Let me step back a bit broadly. Two resources at the national level. One that I had just been participating in earlier this morning, the National Academies of Science, Engineering, and Medicine has about a 5-hour online. It's still streaming live right now, so this link will work for it. Their Division of Behavioral and Social Sciences and Education is in the process of discussing vaccine confidence information and the studies that they've done right now and the polling that they've done that show within certain parts of the country and certain demographics the resistance and skepticism to taking any vaccine or a particular vaccine or who the vaccine comes from, and all those nuances, and how can the government and scientists better explain how vaccines are created, what's in them, why they're valuable, et cetera. And that's a particularly interesting conversation for any of the researchers wanting to feel that their hard work, their commitment, their sincere good faith effort to come up with solutions actually manifests into the public, and that people trust them and take a given test or vaccine if it's available. So look for the link that Juliet will provide there. And also the National Institute of Biomedical Imaging and Bioengineering, which is also part of the National Institute of Health, has a resource that's particularly helpful for organizations or workplaces that they've just recently launched, and its URL is whentotest.org. And it provides all sorts of modeling. You would put in things like your square footage, number of people, other details and aspects of what your workplace is like, and it will give you modeling around certain levels of risks or the types of testing or other sorts of treatments and health types of techniques that you may consider implementing to reduce your risk around COVID-19 transmission. All right, and then back to Colorado, that webpage that I shared, Juliet. Regarding the state of Colorado, I think this is definitely on people's minds, what the phasing may be, and the link is will be something Juliet shares here. But this was the phasing from just a few days ago that the governor's team has put out, and it will somewhat be common sense, or what you might presume is the pacing in terms of who would be getting the vaccines that we are expecting to get in the state. We've gotten some already. Of course, you probably saw on the news or heard the governor announcing when the Pfizer vaccine arrived. But here's a bit of the phasing that probably will give you a better sense of a reality check on how soon you or people of certain say categories could reasonably expect to be finding the vaccine as available to them. There's multiple routes though, and on some of these other websites that I've described to you and listed here, you probably can find some other alternatives, but read up and get familiar with this page from the state. I think it will be most helpful. Something that is not explicit on here, but I hear from both federal and state sources, is the prioritization that may be given in a way to school teachers or everyone from bus drivers, janitors, anyone in schools who would be considered in that essential workforce category, such that we can have the kids go back to school sooner than later. That is still being worked out and may come down to particular school districts working with the state and some of their own, a mix of their funding issues and their sense of urgency or their logistics capacity that will influence exactly how quickly the kids are able to get back into school. But look for that to perhaps influence how this phasing map changes over time. All right, and then back to Colorado. I wanted to emphasize, I got 3 different links here, Juliet, and then I'll be done. But a lot of people presume that when they think of research around COVID, that it's around testing mechanisms or vaccines. And there's actually a few other types of federally funded research going on in Colorado that doesn't touch on vaccines directly that I wanted to share with people. For example, the National Hazard Center at CU Boulder, they're a 40-year-old national information clearinghouse that looks to share information and connect best practices amongst researchers around emergency management and hazards research. And the mental health and displacement and emotional impacts and those kind of societal impacts born of natural disasters is really the theme of what they research. And so with some federal funding, they have 15 new projects, and a couple of them that I just wanted to list here to give you food for thought. I really like, wow, there's much more to this than just being sick. It's everyone's struggling with mental health or other types of challenging displacement issues. Here's the titles of 3 of these. Surviving COVID-19, Risk Factors and Risk Perception in Black Communities. Workplace Safety and Mental Health Distress During COVID-19. Social Media Interventions Against COVID-19 Vaccines, and focusing on rural populations getting misinformation. Mental health impacts of the COVID-19 response on the public health workforce in the United States. So if that's something that these societal impacts are of more interest to you, definitely check out. That's one source there. There's also up at CSU, the economist Jude Baham, who's on staff now as a professor. When he was a Yale postdoctoral researcher, he studied the potential consequences of a global pandemic on how it could close businesses and strain hospitals and shut down schools. And he had created modeling and a dashboard for how to track such a case, if such a situation, if a virus pandemic were to hit the United States. And so that information is part of news that you can get from CSU as well. It's very interviewing him. You can hear his almost sadness around, from his perspective, this was a when not if kind of issue, and sad to see that some of the preparations that were suggested several years ago weren't really acted upon. But in any case, his modeling around this is something quite robust. And then lastly, from what might seem like out of left field, but the U.S. Department of Agriculture's National Wildlife Research Center up in Fort Collins, they are doing COVID-19 transmission and just prevalence research with different wild animals. It's of very much interest to the agricultural community across the country, whether or not wild animals, that could be birds, it could be rabbits, it could be deer, can they get and transmit this to perhaps cattle, to the kind of animals that we're raising for food, and how might that continue to transmit even through to humans, or at least to the people working where they're working with animals. And that's that is developing, and I'll look to have a program on that through CoLabs. I'll be speaking with their director again next week. We're talking about how do we get the word out about that. So I'll make sure I have all of those links on there, but I'll turn it back over to you, Juliet, right now.
Yes, thank you so much.
Thanks for letting me list all that.
No, this is great because so a lot of the conversations that we're seeing, around COVID has been in the immediate. It's been, what are the numbers around that? What is, go and get tested. It has been more of these, restrictions or guidelines that have come out as a result of the rising numbers that are there. But we haven't really seen a lot of this research that's around it or surrounding it, right? We've only seen it as it's debunking things like masks or so the social distancing markers. And so whenever you start talking in detail about, what if anything else can we think of that might be potentially affecting our communities and the people that are dealing with food or are going from one place to another, a lot of this research, I feel like we could have started earlier on, but I'm glad that it is going on because those are questions that everybody, I think, is asking. It's what else was out there that we're not aware of that we could be. And so these deeper dives are, I think, wonderful. And I'm totally geeking out with you as I'm over here like, oh yeah, this is great. And you talk about mental health and all the other implications that COVID has, and that is being looked at. Of course, the African American community, who generally is at a disadvantage for a lot of health issues and diseases that are out there. So I think most of those studies are very timely, and they're necessary right now so that we can continue to combat it in all layers. Now, I don't see any questions, believe it or not, and I know it's probably because we've given us so much information that we've been able to link them to along the way. I know Wayne has shared a quick thank you for facilitating all the information. I know that if you go on your own and click on this, that it is a lot of text and a lot of details. So I think Dan did a wonderful job in summarizing what each link can be used for. But since I don't have any questions, that this means that I get to ask you my personal questions along the way. And you mentioned a wonderful statistic. So CSU, I had no idea about their testing capability or that they were doing that volume. You shared that they had transitioned their vet services area to be able to handle those at a higher risk or dealing with those nursing homes and those types of settings. 60,000 is significant. I mean, I don't know how much, generally comes out of one testing site, but I feel like that is so much more than the ones that I've been around or have been aware of. That being said, are they contracting with those nursing home facilities to be able to do that? Are people signing up on their own? How is it accessible to some of those higher risk communities?
I'm just checking some of my notes here on that program. The CU's Health and Medical Center has been the bridge between the research labs in their veterinary diagnostic laboratory and the Fort Collins community. So there may have either been existing relationships just born of them being a health provider for some of the seniors, or they very quickly, and this I know goes back to conversations I got started in April. There was very much, even before testing was even possible, the brainstorming that was happening urgently with people not sleeping, as far as I could tell, figuring out how do we connect these dots and what do we have. CSU realized, well, if we're given federal, what took a little bit of a pause, and reasonably so, but again, this was all the way back in April, was getting the federal approval for them to say, can we use our lab equipment and our lab space to test for a human virus? Right now it's set up for animals for veterinary purposes. And once they got that through, and I don't recall there being necessarily any deep red tape, it was just that there are just some steps to go through, make sure everyone knows what the left hand knows what the right hand's doing. And then they would have been reaching out into the community. And at the time, then the students weren't on campus. So they were preparing for when the students can come back, how might we be able to test as many of them as possible and do that to facilitate having on-campus classes, which has gotten a bit, as you know, garbled up from there. But they're almost uniquely capable with that diagnostic lab born of animal research to switch over and be testing thousands of humans.
Right. I think the adaptability on that facility was key to their ability to do that. So to that end, Dan, we talked about the implication of our federal labs across the state of Colorado, some of these research facilities and the work that they're doing, you're generally funded, and we went into detail on how you were funded and everything, I believe, in our last broadcast. That being said, how are these dollars or resources that were already allocated to these labs be able to conduct this continual research for COVID? Is this new things that are out there that they're kind of trying to just do in terms of a public good that's there? I mean, how are they funding a lot of what they're able to do right now? Because I feel like this is a lot of work to take on.
Yes, almost all from what I've been familiar with of the funding streams that came through the National Institutes of Health was born of the legislation earlier in the year that Congress approved to significantly fund COVID research into the billions of dollars within the multi-trillion-dollar bailout or recovery legislation that had been passed. There's and still are specific line items of billions of dollars that are prompting, with very urgent timelines, research into COVID, particularly for vaccines and for testing mechanisms, but then also into those other realms that you heard me describe. So it's an intentional legislative decision that Congress made to put money into these pipelines. And to their credit, CSU and CU Anschutz and the other entities I mentioned, they had the ability and the mindset to, many of these scientists simply pivot. And as you might expect, it's its own interesting puzzle to solve. And then, of course, there's an urgency, a societal tragedy that's happening. The scientists who are researching this, they don't sleep, as far as I can tell. Again, they're answering emails at all times of the day, and this is their calling. If you've been a scientist, and particularly a virologist or epidemiologist, someone who researches diseases, this is the kind of setting that you would never hope for, but you would also feel compelled, and this is your calling. This is what you want to work on, and being part of helping address this and mitigate it is it's its own fuel, I'd say. And so they're needing coffee, but not only coffee.
Right. No, I'm totally, and that's probably the best way they could have described it. It's like it's the best time for them to be in the capacity that they're in, because it is allowing them the opportunity to kind of really deep dive into some things that they would have liked to do, or maybe even thought about, but never thought that they would actually be able to implement it. So there is positives in this along the way. And the fact that there are people that are dedicated and committed and truly enjoy doing this type of stuff, I think helps us to overcome it in the long run. We have a lot of folks that hopped on here. Brittany, I also see Jerry and Jeff. Thank you guys for tuning into the broadcast with us. Believe it or not, we're over our 30-minute mark. I told you it would go by so fast, Dan.
Right.
So that means I can't take up any comments or questions. But if you end up watching this video at a later point in time, give us the hashtag replay. Make sure that you share this out to your network so folks can know about the amazing work that our labs are continuing to do as it relates to COVID, outside of just testing, outside of just the vaccines that we're continually hearing about. There are a lot of other questions that are attempting to be answered by some of our research facilities, and I think it is very important that we look into those further. The links are included into the comment section of this broadcast to you at your disposal. You can watch it at any point in time. Some of them are live broadcasts that are going on right now. Some of them are white pages, others that are just kind of those scholarly articles that you guys can look into further. We have with us Dan from CoLabs. He is the executive director and has shared a wealth of information, and I so appreciate him being on here with us. He came to us several months ago and very early on said, here's what things look like, here's what the consortium is trying to do, here's where we can be several weeks from now. And believe it or not, I think that was about 6 months ago. So
wow, it's been that fast. Yeah,
it's been a little bit of a break, but it's been a while. So we were so fortunate that he was able to come on here with us and tune in to the broadcast, of course, and be an active participant to you all, if you think of a question or comment, or if you read something later on and you're thinking, oh, this would have been a great question for me had I had this link beforehand, before the broadcast, always come back to us. You can DM the page, you can comment it onto the video. I will turn that over to Dan and see if he can't get you some help or answers to your questions as well. But Dan, if they have any questions for you specifically, or just want more information about the work that you all do, can you share with me a website, maybe a phone number that I can drop into the comment section for them?
Yes, I was just adding this in here. So,
oh, great.
Thank you. And it's co-labs.org. And there's a lot of course, information around COVID, links to the CDC's website and what's happening in the state of Colorado, and then science of all different kinds from our broader network. So
exciting. So the link is in the comment section for folks to be able to find at a later point in time. Please feel free to peruse all the work that they are doing. So excited to have them here in Colorado, and their presence does not go unnoticed. And then for all of you all, thank you guys so very much for tuning into the broadcast. I'm also including Dan's email and his phone number as well, for you all if you would like to reach out to him directly and have any specific questions. Dan, I appreciate you. You know, I am very fond of the work that you're doing. I can't think of anybody else that could be in the role that you have on a daily basis. So thank you so much for carving out. I promised you 30 minutes. It ended up being about 40, but thank you for covering out like 40 minutes out of your day to be here with us to be able to share this. And I hope you have a wonderful weekend.
You too, Juliet. Thank you. I appreciate it. I'm glad to share this information.